Welcome back to 10 Kids, 2 Docs. I'm Sylvia.
And I'm Vivian. Today, we are going to be talking about screens. There are so many things we can talk about in screens, but to keep it succinct, today we are going to talk about screens and infants, specifically ages 0 to 1. And you may think there's not a lot to say in that age group. There's actually a lot to say, as we found out as we discussed this.
Let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
So Sylvia, go ahead and give me your thoughts on screens and infants.
So I was doing well visits with a family, and the parents, being first-time parents, asked me my thoughts on screens. They were thinking of buying their 1-year-old for their birthday an iPad, and they wanted to know what I thought about that. And I found it very interesting that this question would come up. So basically asked them why they were interested in getting their child an iPad. Why do you feel like you would like to do that? And they actually came up with a surprising answer that they feel like they don't know what to do with their child. Our child seems bored at home. We have our toys and our games, and I think grandmother babysits here and there, and they just kind of don't really know what to do with their child. My advice to them was really based on the American Academy of Pediatric Guidelines, which basically state that children younger than 2 learn and grow when they explore their physical world around them. Their minds learn best when they interact and play with parents, siblings, caregivers, and other children and adults. So the advice that I gave to this family was to not buy their child an iPad, but to actually explore their world, to expand the child's experiences beyond the house sometimes, where you can go for a walk and have the child watch leaves fall off of a tree, or watch a dog walk by, or maybe even go to a playground, sit there. I mean, that's a 1-year-old, not really walking very steadily, but sit in the stroller and watch children play at the playground.
I have a story about this, Sylvia, that you make me think of. So one of my children was born prematurely, and he received occupational therapy for a while. And I loved his occupational therapist. She had been in practice for years. And I remember her talking about how just anecdotally in her practice, she was seeing a difference in these upcoming generations where kids are outside less. And because that's affecting how broad the input that they're taking in is, as far as that broad visual field and all of the sensory input that you take in by being outside, she felt like this was a challenge that she now had to overcome in her practice. And she was really the first person that I remember expressing concern about this. And now, more and more, we're starting to see examples of this in data and research. And I was in my car recently and heard a story on NPR called The Story Around Soaring Myopia in Kids. And just to really summarize that, myopia is nearsightedness. It's based on the focal length at the eye, which is something very quantitative and measurable. And there's data now to show that the more time spent on a screen correlates with a shortening of the focal length and this increase in myopia, which totally makes sense, right? The brain is adapting itself to needing to look at things at a very close distance, as opposed to if you're outside and you're looking at things at a far distance. So what you made me think about when you're talking about taking the baby out in a stroller, even just to watch other children play, is I think we take for granted how just that act of being outside is allowing this developing brain to take in all of this information. The sensory of the temperature and the wind, the depth perception, both visually and auditorily.
Infants learn so much from interacting with the natural world. The last thing I advised this family to do is I encouraged this family to go out there and have their only child interact with other children, be it on a playground, be it with other children their age, watch how they play, watch how they interact with their caregiver. That in of itself is a socialization aspect, that experiencing the world gives them that screens don't.
Sylvia, you brought up the 1-year-old. What about even younger?
Yeah, I want to share with you an experience that I've had in the office where a very mindful first time parent was asking me about screen use in their infant. And particularly in order to be in touch with long distance relatives, they wanted to have a Zoom call with their grandparents so that grandparents could see the infant and the infant could hear the grandparent's voice. And the parent was asking me if I thought that was okay. Is that too much screen use for an infant and whatnot? And I told them to connect with loved ones. I thought that was reasonable.
Oh yeah,
But
absolutely. The benefits of that connection being formed for sure.
right. But I did point out to the parent that the screen use that I'm more concerned about is how the parent uses the screen when they are caretaking their infant, while they're feeding and looking at the screen while their baby's feeding, or while their baby is playing nearby and they're checking their phone. That I was more concerned with the baby seeing their image of their parent always being on
Yes.
their phone, as opposed to the Zoom call that the infant is actually looking at the screen themselves.
Absolutely, right? It's really amazing how much, even at those super young infant ages, they're again taking in that data and starting to process what the mother is doing. And I worry a little bit about the screen depriving or stealing some of that bonding between parent and child, right?
Right, exactly, that eye-to-eye
Yes,
contact,
yes.
that watching the parent's mouth move when they speak,
Yeah,
when the parent is engaged with something else,
yeah.
that doesn't happen, right?
Yeah, and it's difficult because as we've talked about, this parenting, especially this newborn time, can be very lonely. And
Yeah,
so there's a temptation to use social media to fill that void, even though we're understanding more and more in research that social media doesn't actually allow you to feel more interpersonal connection with people. But
right,
I do tell parents, I mean, we also know that the infant's brain is really good at processing voice and language, and that if they can mindfully, instead of scrolling on the phone, use the phone maybe sitting on the table to listen to something audio, whether it's the news or an audiobook, that's all, or even talking on the phone, that's all great for the infant brain. Hearing language at that adult level, even that young infant, that brain is somehow amazingly starting to process all of that.
right,
So yes, the phone is so valuable in helping us feel connected, but if we can transfer it to audio instead of scrolling, I think
right.
there's benefit there.
Yeah, and also, a one-month-old does less interaction, and that might be a time where a new parent develops a habit of being on their phone.
Mm,
And if they are continuing that habit, they're missing that first social smile. They're missing that laugh that their baby does.
yes,
These are the types of things that if you don't pay attention, you may be missing out because the baby is developing so quickly.
absolutely. Yes.
And and that window for interacting is may come, and you may not actually even realize that, right?
Yes, yes, this is so true. Do you have this memory in infancy, Sylvia? I have these memories with my kids. Initially, when you're feeding a newborn, this is their job. They're working so
Mhm.
hard. They have their eyes closed the whole time. They're just fully focused on drinking. And then
Right.
they get just a little bit older and they start opening their eyes and they're eating and opening their eyes. And then they get just a little bit older and they're eating and opening their eyes and they're shifting their gaze all the way to the corner of their eyes to look at you, right?
Mhm.
They're making eye contact with you. And then they get just a little bit older. And as soon as they make eye contact with you, they smile,
Yeah.
right? And then they break the seal.
Yes, yes.
And it's a mess. And you're like, wait, no, you need to be focused on the task. And milk is dribbling out of their mouth.
Yes, I actually had this conversation in the office this week with a parent who was, talking about how the feeds during the day were getting shorter and shorter because the baby was really distracted.
Yes.
The mom couldn't actually speak to anyone else while nursing,
Right, right.
because as soon as someone else walked in the room and spoke, the baby was looking around like, "Who said that?" And the feeding stopped. And I actually I coined the phrase for this. I call it the cone of silence, where there's this period of time where your baby is so eager for that social connection that you have to feed, and not even, like you said, not even make eye contact. You can't even speak to anyone else because then they will be like, "Who are you talking to?"
Yes,
So this is an example of that developing interaction
yes, yes.
that happens within a matter of months, right?
Totally. And I worry that if I'm feeding the baby and holding my phone in the other hand and scrolling, the baby is starting to look up at me and they just see my gaze going past them. And I
Yeah,
have this other worry about this too. We know that scrolling on a phone is giving your brain these small little dopamine hits.
right.
And holding a baby and feeding a baby, certainly breastfeeding, are ways of releasing those feel good hormones, primarily oxytocin. And I just wonder that if I'm doing that and I'm getting that natural hormone release from holding my baby, but at the same time I'm looking at my phone, if my brain is being tricked into thinking that the stimulation is coming from the phone, and that
Yeah,
that somehow even physiologically is interrupting with my bonding with my newborn, right?
right.
I don't know.
It's a great theory, and I've definitely had those thoughts in a similar fashion with teenagers and using their phone and
Oh
having a
gosh.
dissociation with that.
Yes, yes. Ugh.
Surgeon General advisory mentioned that parenting can be lonely
Mhm.
sometimes, and you also mentioned yourself that during infancy, sometimes that isolation can be very lonely, that caregivers will often opt to use screens for themselves. So I think it's difficult because sometimes parenting can be lonely and it can be boring, and opting to pull out your screen, for parents is a very real urge. And I think that a take home message both you and I are saying right now is to resist the urge to get the phone out
Mhm.
and to savor the moment of interacting with your child or baby.
Yeah, as I think about all of this and what I would do if I had a newborn now, I think I might consider doing a social media fast. Kind of like you get married and you go away on a honeymoon. Similarly, I've just had my baby and now I'm on a social media fast.
I want to draw this parallel to a lot of things that mothers do even before they become active parents. So when moms realize that they're pregnant, one of the first things they do is they stop drinking alcohol, right?
Yes.
This it's for the health of the baby. And I feel like, to carry this analogy out, after your baby is born, to then take a social media fast for the benefit of your emerging parenting and your bonding with your baby. I love it.
Yeah. Yes, we should coin some kind of phrase for this and maybe make
Yes.
this a thing. Kind of like the wait until eighth push that you don't give your child a phone until eighth grade. And there should be some term coined for, I've just had my baby and now I'm on my social media fast. It makes me think of a couple more points related to screens and infants. And then maybe we can come up with some kind of concluding guidance for our listeners. So, Sylvia, I'm curious, in your 20 plus years in the office, are there other changes you've seen related to screen use and infants that come to mind?
Being in the pediatrician's office is a very stressful time. When you think of bringing your child to the doctor's office, your child is either sick, which
Mhm.
is stressful for parents, or there's the anticipation of shots, a shot, if not many shots. And that can be
Yes.
very stressful for the child, for the parent. So I recognize that coming to see me is often sometimes the most stressful part of a parent's week. It could be.
Yes, you're totally right. You make me think that without fail, every time I am taking one of my children to the doctor, and it could even be the orthodontist, I get the question, am I getting any shots today?
Right. It's and babies as early as 15 months,
Yes.
they know.
Yes.
They look around, they're like, I know this room.
Yes.
I know this parking lot. Like, they're on to you. They're like, I've sat on this baby scale before.
Oh my gosh.
Like,
Again, like the
I
best
know what's
AI
going on,
we
right.
can even imagine. That brain taking in data and processing it so fast.
Doctor's offices are stressful for parents and children. And I get that. And during stressful times, parents will often do what needs to be done to get through those moments. But one thing that I do see in the office quite obviously a lot now that I never saw, and probably you never saw earlier on in our practices 25 years ago, is when the child, even baby, is getting approached with, impending shots, or Parents, in order to soothe your child, in the past, your baby is crying, the instinct is to pick up your baby, hold them close, shush them, just, be there for them, contact, sound, calmness in the mom. Like, these are things that are classic ways of soothing babies. But what I'm seeing emerging more and more is the way that parents will soothe their children is by getting their phones out.
Mm-hmm.
Babies don't have phones. So as the child is crying or getting worked up about a procedure or a shot, the parent's phone will come out. They'll bring up their favorite video and they'll put it in front of their infant's face.
Right.
To try to distract them for the impending shot or procedure or whatever. And, on first blush, it's effective. Don't get me wrong, this is soothing to the child. The child gets distracted. The child, it's easier to get the procedure or the shot or the examination done. Mm-hmm. I get it. But on a higher level, as I see this more and more, I begin to think this is what we are teaching our children, how to be soothed. Mm-hmm. We are teaching a generation of children that when you're upset, what's going to calm you down is your screen. And that message, it's giving me chills right now just saying it out loud. Is that what we really want our children to be soothed by? It used to be the sound of your mother's voice, the embrace of your father, the patting of your grandparent, like that type of physical touch and interaction used to be soothing. And now it's an inanimate object. I don't know if that's what we want to be doing.
Okay, so Sylvia, this is a hard message, especially for young parents with that newborn who are overwhelmed. Going from 0 to 1 baby was one of the most difficult times in my parenting. What hope and counsel can we give to these young parents who we hope are going to learn from our mistakes and raise Generation Beta even better than we did?
Right. Well, I think it's very natural to kind of set forth rules. Mm-hmm. Don't do this. Don't do that. Don't do that. American Academy of Pediatrics does not recommend, all of these don'ts. But I think one of the hardest parts and what puts parents under pressure is, what do we do instead? I think my coping would probably be related to activity. So leaving the house, even if it's in a stroller on a walk. I think I did that often early on when I had just 2.
Yeah.
I had like double stroller and I would strap them both in and we would go for a walk. I just want to point out that we are looking back on our parenting experience of, for you and I combined, 10 different infants. And we are kind of coming to conclusions on what we could have done better or what was effective for us. And I want people to understand and know that this is not necessarily the way that I executed, raising the infant, and that, I did not follow this advice to a T. And I think one of the unifying advice that we have in almost every scenario is to be mindful of that social interaction. I think that's something that parents in the past never had to actually actively be mindful of.
If I try to give some concluding summary points on this, I would say for that infant developing brain, taking in data from their natural world is by far the best input we can give them. We want them to be experiencing the natural world around them, visually, auditorially, in every way. We also really want to be focused on that parent-infant bonding time and just being mindful of how sometimes the phone can rob us of that interpersonal interaction. We've learned a lot along the way, and we now have the ability to go back and say, well, in retrospect, maybe I would do this differently, but we didn't execute, perfectly in any way. We're not saying that. And I'm also not saying that screens aren't useful at times. I've said in other episodes, I use screens for sleep, safety, and survival, those 3 S's. That'll come up every time too. And even in this infancy period, certainly as you get closer to 1, there are parameters where those issues become a need, and then the screen is very useful. But almost at any age, when I'm talking about screens in the office with parents, I tell them that 95% of the battle is having a parent who is just thoughtful about what they're going to do with the screen.
Right.
Right. And I think that's true here too. We don't know the answers. We don't know what's perfect, but even just having a parent who is thinking critically about it and making decisions on what's best for them and their baby about screen use, I think that's like 90% of the battle right there.
Absolutely. This was a great discussion. We have just explored the tip of the iceberg here when it comes to screens and parenting. There are so many other topics that we wish to explore in future episodes. Questions about screen use in the school-age child, like how much and how to monitor that. When to allow your child to get a tablet, when to allow your child to have a phone, when to allow your child to have a social media account, how to monitor that account, and discussion about the benefits and dangers of social media. So looking forward to future discussions on screens in all aspects of pediatric and parenting.
Sounds great. I can't wait. Well, this is 10 Kids, 2 Docs. I'm Vivian.
And I'm Sylvia. See you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.